Hello, it's Dr. Rhonda Johnson. Today is Thursday, June 15th, 2022. Today I'm talking about racial bias in pulse oximetry. Well, folks, do you have one of these? This little device is called a pulse oximeter. Pulse oximetry measures the level of oxygen saturation in your blood. A normal pulse ox reading is 95% or higher. Values under 90% are considered low. And again, low oxygen levels in your blood are not a good thing because your brain and your heart and all of your tissues need oxygen. Now, many of us bought one of these to have at home during COVID. When I had COVID, I used it to monitor my breathing. Well, it turns out that there have been quite a few studies demonstrating that these pulse oximeter devices have a higher error rate in black people. Turns out that black people can actually have lower oxygen levels, and the pulse oximeter doesn't detect it, because when the technology was developed for these devices, the trials didn't utilize people with melanated skin tones. So there have been some studies that have demonstrated that black patients were 3 times more likely to have low oxygen levels than were assessed by the pulse oximeters during the hospital in the evaluation of their COVID. And that can translate, according to the researchers, in as many as 1 in 10 inaccurate readings among blacks. Now again, these pulse oximeter measurements are used to determine the need for oxygen as well as other COVID-19 treatment protocols. So it's an important part of the hospital evaluation for COVID. So again, even when you come into the emergency room, you get your blood pressure, you get your temperature, they put one of these on, and it may determine what kind of care you get, if you need oxygen, if you get certain drugs to treat COVID. So the FDA has now issued an alert that people do not recommend on these pulse oximeters when assessing the health status, particularly in the treatment of COVID. And it turns out the studies have shown that these home pulse oximeters may even be less accurate than the ones in the hospital. Now, the FDA does not regulate the home pulsimeter devices. So there are a lot of things that can cause your pulse oximeter besides your skin pigmentation to have an inaccurate reading. One, if your circulation's bad, if your temperature if your fingers are cold, if you're a smoker, if you have nail polish on. So again, these devices have to be used with caution, especially if you have COVID and you're brown or black. So if you're having trouble breathing, go by your symptoms. Don't necessarily go by the number on the pulse oximeter. And if you're in the hospital and they tell you that your breathing is okay based upon the number, if you don't feel your breathing is okay, then speak up and be heard, because these machines may not be that accurate. So the bottom line is, folks, there's a lot of COVID out there. A lot of people are still getting sick. A lot of people are still needing to go to the emergency room. And a lot of people are still needing to go to the hospital. But if your skin is melanated, this reading may not be as accurate as it shows. That's my message today. Take care, folks, and be safe.